When he's bushwalking, Joshua Weir is far from the whirring of helicopters, a sound that takes him back to Iraq.
Before you know it, you've done 10 Ks, you've solved all the morning problems and you're calmer, you're able to look at it with fresh set of eyes.
PTSD, depression and anxiety led him to seek specialised treatment, but he had to fly to Melbourne to get it. He'd developed an intense fear of flying and had to be tranquilised to get there.
It was a very big inconvenience, and I was coming off a medication at the time, and we also bought a house at the time. If I'd been in my home state, close to home, I think it would have been much easier.
More than 10 years later, Tasmania doesn't have dedicated trauma recovery beds for veterans and first responders.
When you look at a typical mental health ward, particularly in the private system, there's a lot of noise, there's a lot of people running around, there's a lot of stimulation going on. It's really hard for someone with that hypervigilance and that really increased sense of threat to actually be able to relax in that environment.
Tasmania is home to 17,500 veterans. It's 3.5% of the population, the highest of any state or territory tied with the ACT. RSL Tasmania's CEO wants state politicians to stop deferring to the federal government.
One suicide will affect up to 133 people in the community. Right, that community doesn't care whether it's a federal or state issue, it's now everybody's issue.
There's no sign of a solution. The state government says the federal government is primarily responsible for mental health services for veterans. But the federal government says it only funds access to existing services and the states provide the infrastructure. It says it will continue to pay for transport to services interstate. Alexandra Alvaro, ABC News.